started with 8 member countries. We're up now to 84 member organizations, a global reach, and a lot has been done to improve patient diagnosis, patient advocacy, patient identification. It's been tremendous to help patients around the world, which the ultimate goal is to improve their quality of life.
Creating the path to better health is really what this is all about. Even though we have come a long way over the years, there are still so many places on Earth that don't have access to medication right now. And we want to change that. We also realize that by changing it, or for us to change it, we need a lot of initiatives working together with not only our RPAs, but also with our member organization, understanding what the need is in the different countries. We need to be out there, we need to be listening, we need to help people.
We've seen a massive growth within HAEi with number of member organizations to 84 today and growing. And in order to be global and to cover and to get a global reach, we need to know also what's going on locally. So I use the term global with a local proximity. So we really need to know what's going on in the different regions, in the different countries, in order to be able to work on advocacy that actually matters and benefits the patients that are out there in the individual countries.
The other big part of what we are doing constantly in Hereditary Angioedema International is finding ways to make sure that we are delivering to our member organizations. We exist to serve our member organizations. And the biggest part of what we do for our member organizations is delivered through our regional patient advocates.
I think it's really important to have a global organisation. We've grown from having about 8 countries to about 84 now. And I think the knowledge shared between all those different countries really benefits everybody else. I think with the RPA project now, we have lots of RPAs connecting different countries. We're able to help set up websites to really connect everybody together and share knowledge.
The whole organization is designed in such a way that provides access to the furthermost patients, in all places in the world.
By being present in the regions, we have a much better chance to get our voice heard and to raise awareness for HAE, and most importantly, to gain access to and reimbursement for life-saving medication.
By working together, we can get things done. We can get a reach that we wouldn't be able to do if we were just working at a national level. And the thing about having a global organisation, we can work not just to improve our own situation in our own countries, but we can help by working together to improve things in countries that maybe would not have the strength on their own to make a difference.
We will find ways to deal with governments, we'll find ways to deal with pharmaceutical companies, we'll find ways to even deal internally with whatever the situation is in a country. All of us, through our RPAs at HAE International, are dedicated to helping our member organizations move forward, accelerate their efforts towards broadening access to medicines, or for the first time getting access to medicines. That's what we stand for, that's what we live for, and each one of us, from our RPAs all the way up to HAE leadership, are dedicated to making sure that we help our member organizations achieve their goals.
It's really helping connect local communities together. The Chief Regional Patient Advocate works with the regional patient advocates, and they get contacts with physicians and patient communities where they currently have no medications and no support. So building upon this, they work together and really helps to support each other in building their own organisations as part of the global organisation.
I think it's more than only HAEi creating the path to better health. It's a combination of obviously us as patients, But we wouldn't be able to do it without the great physicians that we have in our community, and you know, those with fire in their eyes that really want to help us, and the same with the pharma industry that invests in the new medications that we have, and we've seen a dramatic growth in the number of medications that are available to patients.
We've heard in some of the meetings over the last, weeks, months, that from a model of just treating attacks to actually, trying to live our lives with no attacks, possibly. Okay, we can't get rid of the disease, but we can get closer to a cure. So the idea that we can actually live our lives without the worry about the next attack, without the worry of our child's next attack or our husband's next attack or whatever, I think that is creating a pathway.
I think that the mutual respect, mutual understanding, and ability to work through all those years without any conflicts, sharing the same ideas and vision, that's one of the greatest achievements that help us leading into the future for the benefits of the patient.
Creating the path to better health is really what this is all about. Even though we have come a long way over the years, there are still so many places on Earth that don't have access to medication right now. And we want to change that.
What HAEi really also needs to concentrate on and do more of is making sure that our constituency, the member organizations, have a much greater voice in what HAEi does and its activities. Look at how we've grown over the years. You are here with us, working hard at your local levels to make things happen. Then we're taking those local efforts and making them regional with a lot of the regional patient meetings that we're having through our regional patient advocates. And then that all boils up. And here we are today, all of us as HAE advocates looking to improve our lives and the lives of our children and our grandchildren and our relatives and anybody else who may be afflicted by hereditary angioedema. You are witnessing the continuation of the HAE global patient movement.